Rush University Medical Center has reached 99% compliance with the COVID-19 vaccine. When Rush first mandated the vaccine for its employees in March, the hospital vaccination rate in the U.S. hovered just at around 65%. Joining me with more about their vaccine rollout is Lisa Weichman Harries, Rush University Medical Center's Director of Employee and Corporate Health Operations. Good morning to you, Lisa. I just want to say, first of all, 99% is pretty darn impressive. How in the world did you manage to get that enormous amount of compliance?
It is. We are really excited about it. We've had a lot of momentum for the vaccine since even before the rollout. So when we went live with our first vaccinations in December, we had a huge demand of employees wanting to get vaccinated as soon as possible. As everyone knows, we've had a large deal of COVID patients here at Rush. So the light at the end of the tunnel was definitely something really exciting for our staff.
I got to ask you, because I'm sure once you put that mandate into effect, you probably wondered, how is this going to be received? Did you get a lot of pushback? What was that like after the announcement?
I think we've seen about the same amount of pushback as other hospitals have seen, where there's small minority of employees who aren't comfortable yet getting the vaccine. So we've been working really closely with everyone to address vaccine hesitancy, arm our managers with toolkits to talk to employees about the vaccine, the safety, the efficacy, why it's so important to have all of our staff vaccinated, both for the safety of our fellow colleagues and for our patients.
And let's talk about that, because outside of religious exemption or health issues, some people might wonder why you need to convince healthcare workers to get a vaccine when they're in an environment that is there to help people. What kind of difference, though, does this actually make in these settings for both the patients and the workers?
I think hesitancy is rooted in all different issues, right? Whether it's a healthcare worker or someone else. I think there's all different historical reasons why someone might have hesitancy, but we are working to address that. And I think our focus on the fact that we have 99% compliance, very high vaccination rate, is both an ode to that from our staff, and then should make all of our patients feel really secure coming here.
Okay, 99%. So what happens to the last percentage that decided not to get vaccinated? Are you still working with them? Do they have to take weekly testing? What's the requirements for them?
So there is weekly testing for anyone. The governor did put that in place with the executive order last month, and that is for anyone who is not fully vaccinated yet or has an approved exemption. So they would have to undergo weekly testing up until 2 weeks after their second dose, which is when the CDC defines someone as fully vaccinated. We're continuing this week to work through our numbers. Our deadline was October 1st, so we want to make sure that nothing was missed, there's no vaccine records that aren't linked appropriately, and make sure that everyone truly is non-compliant before we take any actions for next steps.
Lisa, I bet a lot of other hospitals across the country are looking at you guys as a model or a pilot, and they're probably asking, what exactly did you do? So what do you think it was that made the difference here, really?
I think a big part of it is the fact that we've always had the vaccine readily available. We've set up mass vaccination sites throughout the hospital since December. I think right now we're looking at our original vaccination site from December in our Brennan Pavilion. So we were vaccinating over 1,000 people a day, and we set up another employee vaccination site a few months ago to ensure that everyone had access to the vaccine prior to the mandate. Everyone who's eligible for boosters has access to boosters, and then we're rolling our annual flu shot right into that operation. So it's a busy operation every day, but employees are able to come down, get their vaccine, and then we encourage everyone to go wherever is most convenient for them. So if that's the Walgreens right by their house or coming to their place of work, we're trying to make it as easy as possible.
Okay, Lisa Weichman Harries with Rush University Medical Center. Congratulations, and thanks for joining us this morning. We appreciate your time.
Thank you so much.